Age Tech Innovators.
Welcome to Age Tech Innovators, the podcast where we explore how technology is transforming the way we care for our aging population. I'm Monty, your host, and each week we chat with inspiring leaders who are making a real difference in the lives of older adults, sharing innovations and ideas that help support and uplift those who need it most. Join us as we work together to build a brighter, more caring future. Now, let's dive in. So I'm with Lewis. Lewis is a great friend and a very influential figure in the UK market, I think global market as well. Lewis, run me through who you are and what you do in 60 seconds.
Well, that's a very generous introduction to my introduction, Monty, so thanks for that. Yeah, so I'm Lewis Sheldrake. So I work as a lead commissioner in a London-based local authority. I work within the adult social care space, and I've now been working in local government for coming up to 14 years. In the most recent few months, I've been to Harvard University. I was really lucky in winning a scholarship, and so I did a really intensive program on artificial intelligence, both in terms of the policy and the leadership considerations around that. And I've just actually embarked this week on a new MSc with Imperial College in London, specifically going to be focusing on the use of AI and humanoid robotics within that.
Huge. A very, very exciting emerging market and doing it from a very exciting university as well. Big up Imperial. I think the best. Unbiased, but I think it's the best university in the world.
Well, I think, you're right, Monty. I mean, at the very least, it's the second best in the world according to the latest rankings. But, I think it deserves the top spot, frankly.
So I'm really curious about how you got into this space. What inspired you to enter the age tech social care space? And I'd really love you to mention some of your family history as well, because I know that you come from quite a technical background, or at least a family of technical backgrounds.
Yeah, interesting. Okay, thanks. So as I mentioned at the outset, so I've worked in local government now for coming up to 14 years. I think it's probably worth just touching on some of my background that goes prior to local government. I can't remember if you even know this, Monty, actually. I joined the army at 16 and did that for around about 6 years. I was part of the airborne forces, deployed to Afghanistan. That really was sort of my very early career. And within that, obviously, there's huge use of technology. Some of the stuff that we're now much more kind of aware of around like health, especially mental health, obviously is now becoming much more understood in the military context. And I suppose like the commonality between that career and my career in local government is that of public service. And so moving over into local government was involved in a number of different departments. I worked in community safety for a while. That kind of dovetailed into the acknowledgement that actually we need to think about mental health considerations around some of the community safety stuff that I was involved in, especially around antisocial behaviour and also around the use of technology. And so I made a move over into the social care space and was involved in the sort of prevention initiatives that we were running in my particular authority. In time, I saw a really clear opportunity actually with the evolution of technology for how that could start to address some of our challenges. And so that really is what's kind of inspired me to get involved in this and to really sort of take it from there. So it's now been the better part of 5 years that I've been involved in the sort of age tech, care tech part of local government provision. And I was going to mention your other point. So you asked a bit about my background. So very humble beginnings. Everyone's keen to make, it's very in vogue at the moment to make everyone aware of, what your father did and so on. For what it's worth, my dad actually grew up in North London and was very much, I think, went to school at, 14 or 15, went to work at 14 or 15. He also worked in local government, actually, in a parks department for some time. But then he did make the move over to a form of academia in his sort of mid to late 30s, I believe. And he actually ultimately was a professor at Imperial College. So that's it didn't help me in me getting there at all. But it's interesting, it makes for some very interesting discussions with him. And I think you can't have a podcast unless you plug a book. So his book, which I'd recommend people maybe have a look at, was called Technology, Business and the Market. I think it's still available on Amazon. And quite how up to date it is, it'll be interesting to see. But I think there's principles that will underpin a lot of that stuff and what's happening now that will be highly relevant. So.
And if I say hashtag Lewis, I get 20% off. That's
absolutely, right. Yeah. Hashtag code word Monty 20.
Yeah, like age tech innovators.
Exactly.
That's really cool. So you've come from the 6 years working in the army where you were really supporting people and a lot of the discipline around that, and then you moved over into local government.
Yep.
And now you're moving into what I see is you're exploring a lot of the technology which is working, because as a lead commissioner, you have this test bed where you can introduce new technology to see what is successful and what maybe doesn't work so well. And also, I know that you spend a lot of time visiting other countries around the world.
Yep.
You get some inspiration about what works. Where do you see some of the biggest opportunities for innovation in this space?
Well, this is a great question. So my short answer to that is we need to look outside of our immediate sector. And we probably also need to look out of our country as well. So you mentioned about looking in other countries. So I have recently been appointed to the Global Engagement Committee, part of the International City Managers Association, which do some excellent work all over the world, actually. They've got, I think, 33,000 members, people working in local government. And what's really interesting about some of their work is that it does really enable that kind of best practice and knowledge sharing internationally to kind of look at how other countries are approaching this. And within my current role, there's some really interesting work that we're involved in around looking at how South Korea specifically have utilized digital in a number of their local government services. I think there's looking overseas at other local government organizations, but then there's also looking outside of our immediate sector. And I think that point really is where there's an immense amount of opportunity, and that doesn't happen enough. I think too often I see that we, within our sector, look very much inwardsly. We benchmark what good looks like against other authorities. And in my view, we're setting the bar far too low if we do that. With the best will in the world, X council has done on subject Y, it might be okay, but we risk falling into the trap of cultural relativism within local government. And actually, what we would do well to look at is how other organizations, other sectors, other industries have found efficiency and excellent products, because let's face it, they're operating in the real world. They're operating in a competitive market. If they were offering something that wasn't efficient and wasn't wanted by people, then they wouldn't survive. And I think we really need to adopt some of those mindsets. And there's a huge amount of opportunity there. Like, so much innovation is happening in other sectors. And really, there's so much of that which actually could be emulated, adopted within our particular sector. And I think that's really what we should be aspiring towards.
I completely agree with seeing this. If we look at a graph, it's a bit like we have a local maximum in terms of how it's done. But actually, if we look elsewhere, we think that we're really doing the best. But then we zoom out to see what else is possible, realize that our small, what we think is a big mountain in terms of our peak of excellence, is actually a tiny molehill compared to potentially how it's done in other areas or other countries.
For sure.
The people who are listening right now are probably very curious about South Korea and the innovations going in South Korea. Can you provide what you see as a quick overview of some of the things that stood out?
Yeah, sure. I mean, I have to say, it's very early days with that piece of work. And just for sort of additional context for yourself and listeners, this links into the Thames Freeport program, which is a really huge opportunity. Well, firstly, for our country as a whole, but specifically the region in which I work, it's a massive opportunity there. So we're really trying to encourage that inwards investment, position ourselves as a really good place for companies overseas to do business. The art of that, Monty, I think, is in matching the problems and challenges that we have in our area to prospective solutions that exist on other global markets. And I think that's kind of what we're really trying to tap into here. So specifically to your question, I think when we look at other parts of the world, especially I think the Far East, the attitude towards aging is really quite distinct to that in the West. And with that has come a lot of innovation, a lot of opportunity and effort made to make people's lives better, to support people to age with dignity, not dependency. And I think that some of those tech solutions that are kind of taking hold over there are really very exciting. Everything from toilet tech through to mobility and accessibility to how AI is being integrated across all areas of local government function in South Korea gives us a really exciting kind of exemplar for us to think about how do we emulate some of that and bring that here.
So we've got great places to look at for inspiration, and that allows us to almost raise what our benchmark is for what we expect from our local councils, government, and providers. We've had this in a previous conversation, so I know that you've got some thoughts on this. What do you think the biggest challenge is that we're facing, which gets in the way of us actually raising the bar of what we could do? as a sector in the UK?
So two things. If I was wearing a cynical hat today, it would be complacency, would be the short answer to that. It would be this perception that what we're doing is enough and that, we can continue to do that. We've got by in just doing that for the last however many years, however many decades. And, I think there's a risk that that kind of is what inhibits us and slows us from adopting true innovation. And so I think what we're going to find with that complacency is that we're going to become absolutely overtaken by events. We're going to be unable to continue to provide care to those who most need it. And that, presents us with a huge number of other challenges. And so I think that, the adoption of technology in this particular sector needs to be seen not just as a nice to have, but a moral imperative, in fact. And I think that is, there's a risk that that's missing at the moment. Yeah, I think that, we can't afford to let the complacency hold us back, and innovation really is the only way forward. So we can go into more detail on that, however you like, actually.
Yeah, what do you think? It's the first time I've heard someone say that one of the biggest challenges is the fact that people aren't seeing this as much of a moral imperative as it potentially should be seen. And one of the things, whenever, not to plug your career, but one of the things that I talk about every single presentation is we started this because our granny fell over and we want to support people as they get older because of our family experience. And there's a lot of urgency I try and instill in the team because of the sea of vulnerable people who are getting worse and worse and worse across all ages. How do you think we can try and inspire people within the organizations and within the council, which I know, not talking about any specific councils, but it sometimes has a bad reputation with getting people feeling like, okay, let's go and do this right now because there's people who need our help. How do you think we can overcome this?
Yeah, that's a really, really good question. I mean, I think part of the answer to that is probably something which I would admit to not being especially good at myself, which is, we need to find a way that we take people with us in doing that. And I know that's a very cliche thing to say, but just to be more specific on that, if we don't do that, or if it's perceived as being pushing the use of tech to do something differently, being perceived to be an indictment on how someone else has otherwise always done their business, then it's not going to take off and it's going to get really stuck. And so where I've seen success is where I'm not trying to do all of that myself. And instead, I've been able to lean on some really good colleagues, both internal to my organization, but also to external providers, to really help with that component around culture change, around getting people to win their hearts and minds, quite honestly, in order to get them to recognize that there's a win for everybody in this. I think some of this, Monty, I think almost touches on the intrinsic nature of people, depending on your school of thought. If you're to think, well, people are generally self-interested, then you can understand why people that are presiding over certain services may not want to let something undermine their way of doing things and potentially threaten or be reviewed as a negative reflection on their way of doing business. And so I think there's a way that everybody can win on that those people can recognize that actually this is a way to enhance what they've been doing very well already and to make it more efficient and to improve outcomes and to make it more cost effective, to improve the quality of life for people. And I think that's really the skill in this. I think some of what I'm describing probably is inherent to all sorts of organizations. This isn't unique to the public sector. But I think some of the dynamics and some of the factors that we need to consider in my particular space are quite nuanced, and I'm not entirely convinced that we can do them ourselves solely. I think they really require quite special skills in order to move that forward.
Could you give some examples of some of the nuances?
Yeah, so let's think about this. So if we think about some of the metrics against which we're monitored and what good looks like and how that's measured, I suspect that some of the answers to those questions will be quite distinct in my organization in contrast to yours. And if you're not, if we're not achieving certain things, there's other things that we might be achieving. So this is one of the tensions that I see quite a lot is around the use of a piece of technology and whether that's going to reduce cost or whether it's going to improve quality of life or both. And what's the interplay between those two factors from a policy position and which can we afford and which can we not? And so I think that, by the nature of local government finance at the moment, a lot of the focus is inevitably needing to be on cost sustainability. And actually there's, that makes things somewhat more objective and tangible and easier to measure. But they're very hard conversations if there's perceptions that actually something you're doing is going to have an adverse effect on someone's dignity. And I think I was in a conversation just last week where we were sort of saying, absolutely need to be able to make cost efficiencies. And I think, the taxpayer certainly wants that. Everybody really wants that. And it can't be anything that would have an adverse effect on somebody's quality of life. It can only be at least neutral or ideally an improvement. And that's really what we've been able to see used through the use of care technology.
So along the lines of which metrics do we look at and whether or not it's a cost saving or it's an improvement to outcomes, as maybe reduction in hospital admissions, one of the big differences I see between the US and the UK is that the US tend to look at how will introducing this new bit of technology reduce the amount of money that the insurance companies have to pay out. So then the insurance companies are incentivized, like Medicare Advantage, are incentivized to fund these products because it ultimately means they pay out less. I don't see this in the UK at all. Or if I do, it's within private companies. But I think this is one of the key blockers for innovation happening in the space. I'd love to hear your thoughts on this take as someone who has such a deep understanding of local authority, local government.
Yeah, that's really, really interesting. Wow, where to start with this? Okay, so I think some of the challenges that I'm observing is around some of the challenges around adoption of the use of care technology are partly wrapped up in a kind of misunderstanding around the use of that technology and how it can actually support and enhance existing operating models of some of our domiciliary care providers, as an example, in that they might see it as a direct threat to their way of doing business and almost gives people an existential crisis, and they think that the technology is going to be potentially replacing what they do and they'll get less packages of care and so on. I mean, my reading of that is actually it's the opposite of that. I think the more providers buy into this and use it and apply it, will actually do really well in a business sense. And actually the role of the care worker might evolve and change in terms of how they not necessarily augment in the way of sounding like a cyborg with the technology, but how they actually support and enable that technology to be successful in situ. Additionally, if we believe what we say and what we're saying comes to fruition, specifically, the use of care technology can support people to live independently at home for longer. That's not empty rhetoric, right? Actually, it's demonstrably provable in the sense that, therefore, people will be in their own homes for longer, not going into a residential care home, and therefore prolong the duration of the package for the domiciliary care providers who might otherwise have been resistant to its adoption. And I think that point really needs to be understood, and it's not hammered home hard enough, in my view. I mean, this one is slightly tongue-in-cheek, but you'll hear one of the pushbacks you'll hear about the adoption of technology in the health and social care space will be, especially around older adults and especially at the more acute end, is that there's not enough money. And all I would say is, I'm sure the private equity interests in care homes would absolutely agree with that point. You can read between the lines on that one. I can spell it out if more helpful for listeners.
Can you spell it out just a tiny bit, please? I
can spell it out a tiny bit. Well, sure. I mean, my reading, and there'll be people probably that are currently throwing their phones and ripping their earphones out and don't want to hear anymore. Look, the presence of private equity in the older care space is a hallmark of its profitability, right? Like, otherwise, why would they bother? Let's just cut to the chase, right? So there will be exceptions. Budgets will be tight. There'll be places where actually it's really hard to get investment. And I know that we struggle, certainly in our area, in terms of getting enough placements to support the demographic change and to support older people. But to me, it seems quite lazy, actually, for us to be solely saying there's not enough money in social care, because the very presence of private equity investment suggests otherwise.
And I'm not going to name any names, but we know that some of the largest telecare providers in the UK and in Europe are private equity owned as well.
Right. Now, it may be that private equity owners have very big hearts and this is a philanthropic duty, but you tell me.
I mean, to all of we're actually going to pivot this podcast to the innovators.
Yeah.
That
I have to say, I'd be missing an opportunity if I didn't get this in as well. Look, we as a authority where I work, we have one of our own care homes, and we've put our money where our mouth is on this. We've led by example. We have now deployed a lot of technology in our own. There are not huge financial savings to necessarily be made in there. You've got people that have a high level of needs, need a high level of support. But in terms of quality of life improvement, satisfaction of residents there, we've had some truly amazing things happen in that site. And big shout out actually to Rethink, who've supported us with that. Rethink partners have been outstanding in that happening, working closely, obviously, with our Cove in terms of some technology deployment. And yeah, that's just been outstanding. Some of the stories around residents who've otherwise been pretty much bedbound, actually getting up out of bed, being more engaged, more stimulated to the use of technology, be that things that are sensory based. We've just seen some amazing successes, and the staff as well have, reported how much it's made their lives easier and how they've been able to be a lot more precise and responsive to the needs of the residents there. We're serious about this, and we've proven that with our own investment. And I think it's how do we think about the mechanisms that we can draw upon to get that working in the rest of the market where we place people? And I think that's really what we need to be thinking about. The answers to it are contractual levers, by the way, and we need to be using them.
Okay. Say a little bit more about what you mean by contractual levers.
Yeah, sure. So when we place residents, whether that be in terms of into a care home, whether that be we organise their home care provision for them with domiciliary care agencies, we have mechanisms at that point through the vehicle of contracts. They'll be probably part of a framework. We have service specifications. And what I really think that the local authority sector needs to be doing is using those as the mechanisms and levers to compel providers to use technology, to embrace it, to use it to improve the quality of life of their residents. They're otherwise not going to do it out of the goodness of their own heart, I dare say. And actually, if we're serious about the merits of it and we think it can improve people's lives, we need to be specifying it as such, as a must-have, not a nice-to-have, as I mentioned earlier.
Okay, so you think that it's the actual frameworks that's surrounding the individual care homes, for example, that need to be changed?
I think so, because if you think, Monty, around the progress and evolution that we've seen in a technological sense in the last decade, right? If we just go back 10 years and we think about how tech has changed, we think about digital, we think about how connectivity has changed, and then we also think and we look and compare our service specifications over the past 10 years and how those have changed and adapted. They certainly haven't moved in parallel, nor have they moved in parallel to demographic change, to the transience of population, anything. And so I think it's just really very important that those two things broadly should be tracking in parallel. It's not to say that we're going to be necessarily at the absolute cutting edge forefront of technological innovation across our care settings, but it should at least track progress to some extent. And that's what I think we ought to be doing.
Okay, so let's say we come up with this idea of it needs to be within the contract that everyone in a care home or every care agency need to be introducing in this way, which is actually driving adoption by the service users, these technologies. If we come up with this idea of we want to actually add this to the contracts, the surrounding framework, how is this done? How do we do this?
Yeah, so periodically, all of these contracts, all of these frameworks will be coming up for re-tender. At that point, really, it's incumbent on local authority commissioners to be updating those specifications to bring them, by definition, into the modern era and also fit for the forthcoming period that they're intending to cover. And there's ways that you can be really creative and sufficiently flexible in your contract and in your service specification to plan for what we also don't know today, right? That's is quite an art to this. This is about how do you design in continuous improvement to adopt future technological advancements into a contract. Now, the tension there will be how do you make that legally enforceable? And there are mechanisms to think about how you do that. But also, I should add, this doesn't necessarily need to wait until your current contract that's not due to expire until 2030 is updated. there are opportunities in the intervening period. There are contract variations. There's all sorts of mechanisms that actually local authorities could be using to say we need to bring this up into the modern era. There are benefits to be attained, both for the authority, for the providers themselves, but most importantly of all, for the residents that benefit and receive that care. So I think rather than just let inertia take over, this is going to need to take people being active and applying themselves to make these changes.
We work with a bunch of local authorities, so it's important that I'm very diplomatic when I say this. Sometimes we see it's slow. Sometimes we see this process as maybe arbitrarily slow, where it takes years for any of these changes to happen. I know that you're super proactive and you're aggressively visiting new countries and learning to see what works best and what doesn't work best so much. And so I would say that from people I've chatted to, you're definitely one of the faster moving in terms of driving innovation. How do you see the speed at which innovation is being changed within local government increasing?
So are you asking how can local authorities expedite that process?
Exactly. Yeah. If you say one of the most important things is to change the levers in the contracts and reassess the frameworks, how can they expedite that?
Yeah, it's a great question. So I would say, and there'll be people that no doubt disagree with this, but that's okay. It's encouraged, in fact.
Leave a comment below.
So, public procurement, for all its merits, and it's very important, obviously, for reasons that we needn't even go into now, it should be quite obvious. It's also the antithesis of innovation in many ways, right? By the time you've gone through the process of an open tender and run a procurement and gone through clarifications and gone through evaluation and a mobilization phase and so on, especially if you're talking about tech, by the time you get to the end of that process, you have potentially procured something that's already obsolete. I mean, you can think about all sorts of examples on this in terms of how we've seen iterative changes and updates to software recently. You think about some of the changes that we've seen and updates, even with certain AI solutions month by month. And the risk is that as a local authority, you end up procuring a load of mini disc players because you think it's the latest and greatest and going to change everything. And we're no longer going to use CDs, we're going to use mini discs. And then we all know what happened to mini disc players. And if you don't, have a quick look. But it's I think this is what people are very nervous of. So in terms of how tangibly we can actually speed it up. So I think, again, this comes back to how do you build in these safeguards into the service specification so you're not pegged to GPT 3.5, right? And so actually by the time things go live, you've got the latest iteration. How do you draw off of frameworks? How do you ensure that both procurement and legal support services within an authority and also data protection resource are sufficiently aligned and able to be agile to support these kind of endeavors? And I think, those are the very practical things that I see really can slow things down, like those kind of components. I don't think there's a short and easy answer to actually resolving this if we're going to be wrapped up in existing procurement legislation. I think that's one of the huge inhibitors, actually.
Yeah, I think for the interest of our listeners, this might be a separate conversation where we dive into even more depth. There's a specific episode in terms of what we can do later down the line. I'm conscious of time, and I know that our conversations always go super, super quick. I've got two quick questions, and then I just wanted to say a huge thank you for your time. So first one is, imagine you wake up and you look at your body and you're suddenly a very old man. You have wrinkles all over your hands and you're lost all your hair along the way, and you're 90 years old. What would you like personally to use technology-wise, and what would you like your day-to-day to be like when you're 95 years old?
Yeah, I mean, this is a really great question, and I actually think, Monty, this is the one that everybody who's working in the sector needs to be asking themselves and thinking about. This isn't just about the people that are in receipt of care now; it's also about the fact that we're all going to get there. It's going to come, and it's going to come quicker than we think it is.
Yeah.
So for me, I think it needs to be, a world where things are as frictionless as possible, and also it goes beyond solely addressing our primary needs, right? I'm going to just elaborate on this point a little bit because I think this one's really interesting, if I may. People may disagree. For me, I think if we look at what care is currently providing people, and you think of like the Maslow's hierarchy of needs, and you think about the most foundational primary level of that, actually, at best, current care provision is addressing a small handful of those and not all of them. And there are some of those which actually are either considered unattainable or are too taboo to even discuss. And my view is actually where tech is going to take us is that all of those primary needs actually can readily be met through the use of technology. We think about some of the stuff that I'm looking at in my master's around, AI humanoid robots. Come on, this stuff's going to be super, super exciting, and actually is going to, I appreciate that's so far off for like a lot of people at the moment, and the technological advancement that's going to be required to actually get that and make that feasible is still a relatively long way off, but it will be actually within our lifetime. And so I think we need to think about that. What is the current deficit that exists in terms of people's primary care needs as a minimum being met, and how can tech in the future better address those? And that I think is super exciting.
That's huge. So it's no longer to the listeners out there right now. It's not about how can I address maybe in the long term this fall detection. It's actually how can I help people become more emotionally regulated? How can I help them move up that? How can we help people become enlightened? Ultimately, I mean, that's
100%.
That's a joke, but seriously, how can we move
100%.
people towards that space where they have time to reflect and a healthy and supportive environment where all their basic needs are met on a scalable basis so they can grow as a human being?
Exactly right. And if you think about, could get quite deep, and I appreciate we haven't got a huge amount of time left, but like when we just think about the things that are in our lives now, when we've got, like the blessing of being fit and healthy, and the things that we have in our life that actually help satisfy our, spiritual needs, like help us towards self-actualization. In fact, like so many of those things are like readily supported through technology, and that's only going to improve. And we need to move away from this idea that what we mean by care provision is people being fed, washed, medicated, and then left on their own again, towards one that actually thinks about like how do we help them have love and belonging and esteem and personality and creativity and like companionship and all these things. Like it's a real sad indictment actually that the extent of lots of social isolation projects rarely get beyond the pilot phase. We all know how important that is. We all know that like there's a reason that solitary confinement is a punishment. So yeah, I just think we need to think through that stuff and look at the opportunities that exist out there.
That's huge. I really agree, and I really appreciate your take. Your last question, or the last question I have, is for people who are listening to this, who have seen your life and have seen the fact you've been in local government and you've been in the army and you're around the world, Harvard and now Imperial, and you're a lead commissioner, so you've had quite a lot of experience. What would you say to people who are interested in either creating innovation and bringing it to the market, or interested in a career within this space? What would you say? Do you have any encouraging words for them?
Well, I think, on the back of what we've just said, I think what we're kind of saying is that, age tech, care tech is like one of the most impactful sectors to work in. And so people that have got a passion to work with technology and a desire to make a difference, I don't think there's like a better place to be. And I would really encourage people to embrace that challenge. As we said, this is going to hit all of us, or either directly or indirectly, our family members, sometime soon. So I think, this isn't just about tech. It's about how do we shape society. And I think there's like so much opportunity and so much potential there. And also, Monty, I have to say, like, we need to bring people into this who are not thinking about being in this space. You don't need to necessarily really understand health and social care or necessarily be hugely interested in it. I think actually there's like a lot of synergies and kind of cross-pollination, to use all the jargon, to think about how do we do all this better. And I think we need people that are thinking outside of the existing parameters currently.
As my final summary, I appreciate that the conversation we have so often reverts back to the grander vision of what can we do to shape society, rather than how can we just improve our X sensor or our Y product.
Yeah.
And that's ultimately, I really appreciate the conversation. Lewis, it's been awesome. I've had a lot of fun. Thanks so much for your time, and I'll chat to you soon.
Nice one. Thanks, Monty. Cheers.
All right, peace.
Bye-bye. Bye.